Our declaration is that, having noted the high rate of maternal, newborn, and under-5 child mortality, and the insufficiency of our current efforts to reverse the trend, I hereby declare a state of public health concern on maternal, newborn, and child deaths occurring at the primary healthcare and community levels, and a decision to establish a national coordination center within NPHCDA to provide oversight on RMN-CAH plus N activities at the primary healthcare level. This center shall be called the National Emergency Maternal and Child Health Intervention Center, NEMCHIC. This center will work with the National Polio Emergency Operations Center and transit polio resources towards RMN-CAH plus N interventions. We will use the same structures to overcome this poor data, working with our traditional institutions the way we've been able to take control of the polio epidemic. Similarly, in the states where polio EOCs exist, there will be a seamless transition to these state emergency coordination centers. Where polio EOCs do not exist, we shall work with our state primary healthcare boards to immediately establish state emergency maternal and child health intervention centers, SEMCHICs. So what shall we do differently? We commit to urgently take action to provide leadership to rapidly reverse maternal, newborn, and child deaths by half by 2021 through interventions that target the primary healthcare and community levels. This is based on evidence that a minimum of 53% reduction in maternal mortality rate every year is possible. But this is the level that is required for us to reach the Sustainable Development Goals 2030 target of less than 70 deaths per 100,000 live births.
We'll also, as we did before with polio, do all we can to help advocate for further support from our governors and also for full involvement of our communities, from local governments to villages and districts. We will continue the surveillance and monitoring and provide with you all the information we're able to gather so that, like we did with polio, by bringing out figures of cases in states which motivated governors to put in more, we'll now be bringing names and addresses of mothers and children that died during this process, so that we don't continue to look at them as just figures, but as individuals that have relations, that have sons and daughters and brothers that died in a process that's supposed to give life. With the hope of not shaming the families this time around, but urging the conscience of our political leaders to do more, and in turn, honoring the dead, because through them we'll be able to raise consciousness and awareness and commitment of our government. I assure ED, on behalf of His Eminence and the entire Northern Nigerian traditional leaders, that will give this new initiative all it needs to succeed. Wassalamu alaikum wa rahmatullah. Thank you.